Gloves off. Hey guys, welcome back. I'm David Rice, Chief Editor here at DentistryIQ with
Katrina Sanders, the dental hygienist.
We might have a topic of interest, especially for all you young dental pros today. What are we talking about, Katrina?
Oh my gosh. We are talking about what happens when you get an entire arsenal of patients from a retired hygienist or from a retired dentist, which I don't know about you, David, but I'm starting to see a lot of newer grads, newer dental school grads coming out, working a few years and then buying a practice from a retired dentist. And they're assuming all of those charts from that dentist who retired, or new grad hygienists, or not even necessarily new grad, hygienists that are making a change. And hey, this hygienist just retired. We need somebody to take over his or her patients.
Yeah.
And what they're stepping into, they start to understand is a bit more of a challenge than just introducing yourself to the patient. And what I mean by that, and I'm just going to say it because it's a provocative topic, but I think we see a lot of supervised neglect in those patient cases. And I think the challenge for dentistry is, how do you create that transfer of trust? The patients, we're seeing this dentist or we're seeing this hygienist, many of them for years. I mean, how often do we see this, right? They've been seeing them for years. And now all of a sudden you're a new face, you're a brand new face. They don't know anything about you. And now you have to establish trust without throwing your esteemed retired colleague under the bus, and trying to help kind of move that patient into a standard of excellence that perhaps they never experienced before, or in many cases weren't even aware is occurring. I'm gonna let you start with this tough one. What are some things, some strategies that you've seen that have been successful in walking through seeing dental patients from a retired dentist?
I will tell you, and I'll caveat this, right? And we've said this kind of in every episode, so we're not lumping all us old folks who've been doing this for a while in a category, but let's put it in a box because I think it works really well for educational purposes. So assuming we're inheriting a group of patients who maybe need more help than they've been getting, I think verbal skills are really important. More importantly, let me rewind for a second, listening, right?
Yes.
Introducing yourself and asking a patient a little bit about their experience in the past, what they liked best, what maybe they didn't like so much. And just taking the couple minutes, God, we're going back to our very first episode, finding those magic minutes of taking that time in the beginning to really understand what's most important to that individual patient in your chair. And then once you've done that, I think I like to ask for permission. So, hey, Katrina, this is the first time I've met you. Dr. Mark's taken great care of you for 20 years, but things change. Do I have your permission just to share out loud everything that I see that concerns me? And then if I get a yes, I'm not throwing Dr. Mark under the chair so much as saying, here's what I'm seeing right now.
Yeah.
This might be different from 6 months ago or a year ago, whenever the last time you were in. I mean, that's kind of my lead in. How about you?
Oh gosh. Well, first of all, I absolutely love that you ask for the patient's permission. Adult learners are very different than, your pediatric learners. Kids are taught, like, if an adult tells you to go sit in the corner, you go sit in the corner, you just follow those directions. Adults are a little bit different. Wait a minute, why am I sitting in the corner type thing? So I love that. Co-discovery is huge. Helping patients to understand and getting their permission is massive. I absolutely love that. I will say a few things. Number one, I think this goes back to patient trust. Patients are smart and they know when you're kind of hemming and hawing and kind of tiptoeing around something. They know when it's like, oh, and you don't really know exactly how to convey that. I'm working with a practice right now where this exact thing is going on. They assumed a practice, a bunch of charts, and with it came a seasoned hygienist. And in this particular scenario, these patients absolutely loved this hygienist, and they eventually had to let this seasoned hygienist go. And so now the gals, the hygiene gals in this practice are assuming all of these patients. And there were fears, how do we walk these patients through needing to take these x-rays now? How do we walk these patients through probing? How do we, things that these patients weren't getting before when the trust was over here. Well, one thing I will say that this practice was very pleasantly surprised in is patients were pleasantly surprised or open to, oh my gosh, I didn't know that there was new technology about, how to look at these x-rays. I didn't know that there was a piece of equipment that sprayed water that could clean the tartar off my teeth, or whatever that is. What I mean to say is oftentimes patients are pleasantly surprised. They like that change. In every other area of medicine, you go into like my OBGYN's office, like they've got a new way to do mammograms now that's like more comfortable and is more diagnostic. And at no point is my OBGYN feeling bad, like, they gave bad or poor mammograms 2 years ago. They're excited about this new technology and they're excited to bring it in and they're excited to show the patients that this is new equipment that's readily available. So I will say the vast majority of patients are delighted. There's a reason why they're sitting in your chair, right? I think we assume too much that they're just here for their free cleaning. But we need to get to the bottom of that. And one thing that I really love, there are a lot of things that I love that you say, but one of the things that I loved is talking to the patient about their motivator. The steps of motivational interviewing are really important. If this is a new patient to you, or you're gathering all of these new patients from a whole group of a practice, identify, ask them open-ended questions, get them to start talking, ask them, affirm for them. If they're saying, I'm here for my free cleaning, or, I'm here because Dr. So-and-so was always looking at this one tooth, affirm for them. I hear you. And I am concerned about this. Reflective listening is so important. Let the patient talk, let the patient share about what matters to them, what their motivators are. And summary is the final step in motivational interviewing. That all too often, we're throwing so much at our patients. I always ask hygienists, like, how often do you finish using the ultrasonic? And the patient goes, well, that's new. And it's like, no, it's not. I've used it on you every time for the past, 10 years since I've been seeing you. Yeah. But patients aren't oftentimes paying attention. So when you're talking, especially to a new patient, to you, this entire process is different. The step-by-steps of, even the choreographed dance of a hygiene appointment, or how the hygienist and the doctor are communicating, feels different to the patient. Walk them through that, help them understand. And so now I'm going to go ahead and perform an oral cancer screening. I'm going to be checking the tissues around your head and neck. Don't just go in and start tugging the tongue to the left and to the right. Bringing the patient along in that journey and helping them understand that why. Because patients do truly want to trust us, and they do they understand, okay, this doctor retired. They want to connect with you. They want to find that same connection that they had with their previous dentist. Yeah. So give them that opportunity to be able to do that.
I love that. And, I think what you really were alluding to too is frame your story. Yes. So to your point, how many patients have sat in all of our chairs and say, I've never had an oral cancer exam before? And the answer is you have. It's just nobody announced it to you in the past.
Right. Yep.
So, and just using that as one simple example, you could share like, hey, I'm about to give you this great oral cancer exam. I'm sure Katrina did this for you last time. She may or may not have even said it out loud because You've known each other for so long. That lets Katrina off the hook. If she never did it,
that's right.
And it kind of just brings objective need to the table. And you said something else really, really good. Anytime we have an opportunity to maximize technology, to bring things to a place where it's not subjective on my part, it's just, here it is. So whether it's an intraoral camera, an amazing way to take a picture and put it up, or a scanner. God, some of the scanners out there today, I'm not sure what experience you have. We've used a bunch, but like some of the tech in the new iTerra 5D Element, like lets us track from, 6 months ago to today, a year from now. It's crazy. And those are things that make people feel comfortable because they can see it and it's them.
Yes.
And it's tough to argue that.
It's a calibrated piece of equipment. So you're literally saying, this is where you were 6 months ago. This is where you were today, instead of, to your point, some of the subjectivity that patients do, well, yeah, of course I'm bleeding from the mouth. You stabbed me with that tiny little sword, and so they think that a lot of these things are very subjective. So I absolutely agree. I think patients get very excited to see what new technology is out there. And I people like you, we light up when we get to use this technology and we get to show and educate our patients and bring them along in this journey and help them understand. So when you come back in 6 months, I'm going to scan you again because I want to see if this is moving. I want to see if this is stable. So now they're a part of the process. There isn't this line in the sand between I'm over here and you're over there. We're collaborating together and really creating an awareness about the disease process. And now your motivator is being influenced. Right? We cannot change a patient's attitudes, values, perceptions, or beliefs. We cannot change it, but we can influence it. And we can do that by bringing them along in the journey and helping them understand the why. So I love that.
Awesome. All right. So wrap us up with this. The line between helping a patient feel comfortable and falling down the same trap that the prior hygienist or dentist fell into, and then you wake up a year from now and you're afraid to tell them the truth because you tried to buy yourself a window.
Oh my gosh, that is the provocative statement of the year, is it not? I do work with a lot of practices that will say things like, well, I'll let the patient know this is what I see today, and let's just check you next time and see, what that looks like, which is a really beautiful way in some regards to let the patient know, I want to learn a little bit more about you. I want to learn about how your body responds. If I'm still seeing this infection, or if this, I don't know if this crack in this tooth is still there. I mean, it's still going to be, so I guess what I mean to say is, yes, there is a fine line. There's a fine line for some patients where you can temporize it and say, you know what, I'd really like to evaluate this again. Versus in other cases where it's like, what are you saying? Again, patients want to trust you. So if you're saying something and it doesn't even make sense as you're saying it, like, this tooth is cracked, so I don't know, let's check it again next time. What does that even mean? It's cracked. Tell the patient about what's going on. Tell the patient about what they need. The one challenge I will say is patients ask us this all the time. So is this super urgent? Like, do I need to get this treated right away? Right. And this is what we think. This is what dental professionals think. Well, you're not going to die if you don't get your amalgam fixed tomorrow. That's what we go to the extreme. Like, are you going to die? I guess you're not going to die. So I guess you could wait on it. When the reality is that we need to tell the patient, you have a fracture in your tooth at any point in time you could bite down on. And how many times do patients say, yeah, I was, eating avocado toast, like the softest, weirdest thing. And all of a sudden my tooth broke. So, I think we need to be very careful about specifically what we say to patients. And to your point, not getting on that hamster wheel. If the patient has gum tissue inflammation and you want to see how the patient responds, let the patient know. If it's true inflammation, it'll go down in 2 weeks, period. If it doesn't go down in 2 weeks, there's something more going on, or you need blood work, you need testing, something else is going on. If it's periodontal disease and you want to see if the patient is healed via the long junctional epithelium, 6 to 8 weeks. So, this whole like, oh, let's clean you up today and see you back in 6 months. I mean, that's too much of a runway. Yes. And now the patient isn't going to take you seriously. You need to let the patient understand we're going to intentionally evaluate what this looks like. And I think every practice needs to draw a line in the sand about what is something that we can give the patient a little bit more of a runway, try to floss better or whatever, versus what is just overtly negligent if you're going to continue to temporize that patient.
Yeah, friends, so much goodness coming out here today. Thanks for hanging out with us. We will see you next time. We're going to talk next time about what? How to respond to You're Not My Normal, RDH. So stay tuned. It's going to be a good one. I hope you all had a great day and took something home from this. Katrina, always good to see you.
Good to see you.